All right, prior to coming into the room, I've evaluated the patient's chart to see any of their history, their baseline vital signs. So when I go in there and take their blood pressure, their temperature, take their pulse, and evaluate their skin integrity, I can see any history or conditions that they do have to assess where they're progressing. I get my stethoscope. I'd also evaluate if there's any PPE I need to wear. I'd wash my hands prior to coming into the room. I'd enter, pull the curtain. Hello, my name is Sam. I'll be your nurse today. I'm here to do a head-to-toe assessment. Can I please get your name and date of birth?
Franco Lombardo, August 31st, 1965.
All right. So far, me walking into the room, I'm evaluating so far her overall posture to see if she's comfortable. I'm also going to go ahead and ask her. On a scale of 1 to 10, Miss Lombardo, are you experiencing any pain? 1 being no pain at all, 10 being the worst pain.
1.
All right. And overall, do you feel okay in the environment? Is the temperature okay? You're not too hot or too cold?
Fine.
You're fine? All right. And then do you need to go to the restroom before we begin your head-to-toe assessment?
Yes.
All right. Let's go ahead and get you to the restroom. All right. So like I was saying before, we're going to continue with the head-to-toe assessment. There's no pain associated whatsoever. I'm just assessing to make sure your skin is intact, overall assessment of, overall body health from scalp to toes. Can you repeat your name?
Franco Lombardo,
All right, and then do you know who the president is?
Donald Trump.
All right, and then do you know where you're at?
My house.
All right, and I'm gonna go ahead and listen to your heart sounds, your chest sound, and make sure that everything is good. All right, and do you have any anxiety or depression?
No.
Any feelings of that? All right,
No.
and overall, do you feel safe?
Yes.
You do? Okay, I'm going to go ahead and evaluate your skin, if that's all right with you.
Yes.
Okay, I'm going to go ahead and put my gloves on, and at this point, I'm going to assess skin for any bruising, lesions, rash, tattoos, piercings, anything to just assess the overall integrity of the skin. All right. I'm checking for turgors, skin turgors, everything looks good. All right, let me go ahead and assess your arms. All right. Okay, your overall skin, legs. And seeing that there's a reflex of oxygen back to the finger cuticles, everything looks good. All right, and now that I've assessed your skin in the front and in the back of you, your skin is hydrated, everything is intact, there's no bruises, no lesions. I've checked the integrity of the skin. I'm going to go ahead and take your vitals. I'm going to go ahead and take your vitals before listening to heart sounds. So we're going to go ahead and take your temperature, your pulse. I'm going to take your pulse and your respirations for 1 minute, and your heart rate. If it is regular or irregular, I will take it for a minute, and if it's regular, 30 seconds times 2. While evaluating her baseline, her radial pulse was 96, which is normal, and for blood pressure, 120. I'm going to add 30 beats to compensate, so I'm going to inflate the blood pressure cuff to 150, given this would be her normal range. I'm going to go ahead and do that. I've already taken her temperature, which was 98.1, and her respirations I looked at for 1 minute, and they were 17 respirations a minute, which is in normal range. An adult is anywhere between 12 and 20. So I'm now going to take her blood pressure. All right, very good. Your blood pressure is 116/84, which is normal, and that is normal for you as well. So, and now I'm just going to evaluate your scalp and just make sure everything is good and there's no lesions, bruises, or indentations in here. Very nice. And as I'm evaluating, the patient's been smiling and is having a good time. So I can evaluate that by her face. There's symmetry, there's no droopiness and no indication of a prior stroke. And now I'm going to assess cranial nerves 1 and 2, 1 being the olfactory one. I'm just going to have you close one eye and plug one nostril. And are you able to smell the scent?
Yes.
What is it?
Lavender.
Okay, and we're going to go ahead and try the other nostril. All right, and now we're going to go ahead and assess the second cranial nerve, the optic nerve. And I'm going to have you place one hand over one of your eyes, okay? And because there is some distance, I'm going to have, this is the Snell test, and I'm going to go ahead and have her evaluate something to get her visual acuity and see if it's equal or the same in the other eye as well. All right, and are you able to try with the other eye? All right, and cover this other eye. All right, and the response was the same for both, so the optic nerve is all right. I'm now going to go ahead and assess cranial nerve 3, 4, and 6. I'm going to start out with cranial nerve 3, which is ocular motor, and I have here an eye light for pupil gauge. All right, I'm just going to have you focus on this back object behind me, and I'm looking for pupil constriction when I shine the light in front of your eyes. Very good on this side. Okay, and can you focus on this pen? I'm going to bring it closer and further apart. All right, dilation is the same, equal in both eyes. After evaluating cranial nerve 4, trochlear, for overall eye movement, I'm going to check the cranial nerve 6, abducens, for lateral eye movement as well. If you can go ahead and follow this pen light. All right, patient seems to be good. This is an overall good assessment of this cranial nerve. And cranial nerve 5, trigeminal, is right here in the jawline. I'm going to go ahead and ask the patient, can you go ahead and clench down on your teeth? All right, and I'm just going to go ahead and check that both are symmetrical and the same on both sides. All right, this is good. Next, we're going to go ahead and evaluate cranial nerve number 7. Cranial nerve number 7, I'm going to evaluate is facial. All right, can I have you lift your eyebrows up? All right, and can you puff out your cheeks? And go ahead and smile. All right, everything is symmetrical in the patient's face. Next, the next cranial nerve I'm going to go ahead and assess is cranial nerve 8. Cranial nerve 8 is acoustic, so I'm going to do this by evaluating the patient's hearing in both ears by having her cover one ear, me whispering something in the opposing ear, and her repeating it back to me. All right, can I go ahead and have you cover one of your ears? All right, and I'm going to go ahead and whisper something, and you go ahead and repeat to me what I said. Orange.
Orange.
All right, and we're going to go ahead and try with the other one. Apple.
Apple.
All right. All right, cranial nerve 9 and 10. 9, glossopharyngeal. This is where I would, with the correct equipment, demonstrate a gag reflex. Can you go ahead and say ah?
Ah.
All right, and with the correct equipment, if I had that at this point, then I would go ahead and do this. Cranial nerve 10, vagus, is for the patient to swallow. Can you go ahead and swallow? All right, the patient has good reflex of that. Cranial nerve 11, the accessory nerve. We're going to go ahead, and can you go ahead and follow me and shrug your shoulders back and forward? All right, is there any discomfort? All right, and then can you go ahead and turn your head to the left and then to the right? And are you able to look up and down to the floor? All right, and cranial nerve 12, hypoglossal. This is to evaluate the patient's tongue movement. Can you go ahead and stick your tongue out? And just for tongue movement is what we're evaluating. Stick your tongue up, down, all right, and to the left, and to the right, and then spin. Okay, very good. Everything is good. I'm going to go ahead and assess the oral cavity of my patient. Can you go ahead and open your mouth? All right, and I'm assessing for any redness, swelling, pus, any kind of thrush, anything abnormal to this. All right, everything looks good. I'm next going to go ahead and palpitate and evaluate the patient's lymph nodes. All right, to make sure that there's no swelling here as well. All right. And everything is symmetrical thus far. Next, I'm going to go ahead and auscultate and palpate the carotid arteries with the bell. All right, so if you could just hold your breath for me. Take a breath in and hold it. All right. And we're going to do the other side. Okay, and since while listening and auscultating her carotid arteries, I didn't hear any swooshing or any abnormalities bilaterally. Everything has been symmetrical. When palpating, the pressure seems the same on both sides. Okay, good. All right, at this point, I'm going to go ahead and work on the abdominal side. I'm looking for equalness in both sides. The skin is good here, everything, and I'm going to listen to all 4 quadrants for about 15 seconds each. And at this point, I'd be listening for bowel sounds, so I'm going to go ahead and do that. All right, another 15 seconds. All right, and you want to make sure to put the stethoscope against the patient's skin and not have any clothes interfere with the sound. Now that I've listened to all 4 quadrants, she does have active bowel sounds. I'm now going to percuss. I should hear a hollow sound. That would be normal, and that is what I'm looking for. All right. Okay. I did hear a hollow sound in each quadrant as well. All right, I'm now going to go ahead and palpate. I'm going to do light palpitations, about 1 to 2 centimeters deep, about 3 in each quadrant. All right, everything is good in the abdominal region of this patient. Since she is in the laying down position, I would efficiently check her femoral pulse at this point. All right, at this point, if this patient had any tubing, catheters, perineal care, anything that needed to be evaluated, this would be the point in which I would do that. And I'm going to go ahead and have you sit up for me. All right. Okay, and I'm going to remove my gloves. I've gone ahead and washed my hands, and I'm now going to evaluate with the back of my palms any moisture in the patient's skin, redness, and just continue to evaluate upper extremity limbs. All right, the patient's color is the same on both sides. The moisture, there's no moisture, so now I'm going to do the same with her legs. With evaluating her legs, examining the patient's feet. All right, everything is good. I see good blood flow and circulation. Now we're gonna test your range of motion. Okay, can you put your arms out like this, and can you stretch them up and in front of you? All right, and then can you spin them? All right, this patient has full range of motion. Good job, good job. All right. And now, can you go ahead and push down on my hands? All right, I'm testing the patient's strength. She's very strong, thank you. And now do the opposite, just push up on my hands. Okay, now lift up. Okay, the pressure's equal, and can you go ahead and squeeze my hands? All right, good strength. All right, at this point, because the patient is in the laying down position, I've gone ahead and comfortably adjusted her leg, and now I'm gonna try and find peripheral pulses. So I'm going to start out with the dorsalis pedis. Okay, and if I wasn't able to find this patient's pulse, the dorsalis pedis, then I would get a Doppler. Now I'm going to move to the popliteal, okay? I'm going to lift you up and right into the grooves. I'll be able to feel for this pulse. All right, thank you. All right, and I was able to find this pulse, and like I said earlier, if I wasn't able to, I would use a Doppler, and at this point, if I didn't do it earlier, finding her femoral artery, I would at this point. All right, now the same thing that we did with your hands, we're gonna do it with your lower extremities as well. So imagine that my hands are gas pedals and you're pressing down to them. All right. All right, and then you're gonna lift up. Okay. All right. The strength is equal on both sides. This patient's in good strength. And if I can have you stand up, are you able to walk a few steps for me?
Yes,
To see your balance. All right, can you open your arm? All right, and then put them down. And can you take a few steps for me? Very good, Mrs. Lombardo. Okay, can you go back to the bed? Now I'm going to listen to your heart and lung sounds. The first sound that I'm going to listen for with my diaphragm is going to be the aortic. This would be the first one, and this is going to be in the second intercostal space on the right external border. So I'm going to go ahead and put my stethoscope on and listen there. All right, and can you inhale? Nice. All right, and the second one is going to be the pulmonic, and it's going to be the second intercostal space in the left sternal border. All right, in the third intercostal space, the herbs I'm going to check for. And then after that, I'm going to check for the tricuspid in the fourth intercostal. And that would be right here. Right here. And then the mitral on the left apical pulse. All right, and then at this point, this is when I would count the apical pulse and evaluate this patient. It could be said that there is an acronym APE to man, aortic, pulmonic, herbs, and then mitral, aortic, pulse. And then after, at this point, counting your heart rate of the apical pulse for 1 minute, I would use the bell if my stethoscope had a bell, or press a little bit deeper depending on what stethoscope you have. So I would use the bell side, and I would be listening for any heart murmurs or anything at this point. Okay, and with the diaphragm, I'm just going to go ahead and just breathe normally. I'm going to check your the patient's lung sounds anteriorly, and I'm going to start with the apex. At this point now, I'm going to listen to the second intercostal space, the fourth, and then the sixth. Breathe. Breathe. All right, the fourth intercostal space, breathe.
You don't want to hear me breathe.
Nice. That was nice. And everything was equal bilaterally. The patient's chest moved equally as I was assessing. Now I'm going to go to the posterior part of the patient, so I'll have her sit on facing that way so I can better assess her. Okay, and I don't want to listen for the patient directly on the spine. I'm looking bilaterally to it, so for C3 to, or C7 to T3. So I'm going to listen for this patient. Okay. I don't want to, because I would want to do between the spine and scapula right in here. This is where I would be listening with each breath that the patient takes. I'm going to continue going down, listening, ausculting this patient's lung sounds all the way till T10. And I didn't hear any wheezing, crackling, any abnormalities. Everything sounded clear, and seeing that everything was, there was an equal lift with every breath as well. That'll conclude our head-to-toe assessment. Ms. Lombardo, everything was good. There's nothing that is concerning at this point for me to continue to take additional steps to contact provider. And I did already have background knowledge of this patient prior to coming into the room and everything. So, is there anything you need at this moment?
Yeah, to be out of here.
All right. Okay. And all right. Do you have any questions about anything?
No, everything is good.
Okay. So I'm gonna go ahead. Here's your call light, and I'm gonna make sure you have your call light and the tray table so that she's able to access her water, her reading glasses if a patient would have that or anything else, and it would reduce the fall risk. I'm gonna go wash my hands, exit the room, and I'm gonna document my findings and go and continue with my evaluation from there.